Good morning, good afternoon, good evening, everyone. Welcome to this webinar. The name is a very catchy name, which is Machine That Go Ping, Neonatal Maternal Care Device Landscape, Now and Next. So feel very welcome, and you're very excited to be here. Machines are my language, and I'm happy to be the one hosting you today. We're excited to welcome you to our Newborn Toolkit webinar, exploring the latest in neonatal and maternal care technologies. Join us as we spotlight key device innovations, share updates from the EWENE Commodities and Devices Group, and explore how we can accelerate access to essential technologies for newborn and mothers across Africa and beyond. This session brings together partners, practitioners, and innovators driving change at the heart of neonatal care, all committed to giving every small baby a fighting chance. Next slide. Thinking about the Newborn Toolkit, it's multi-country, multilingual learning platform supporting high-quality small and sick newborn care, reaching over 62,500 users across 170 countries in 2025. Next slide, please. I've just started talking and you don't know who I am. If you don't know, my name is Dr. June Madete. I'm a senior lecturer at Kenyatta University in Nairobi, Kenya. I also work with NEST 360 as a biomedical engineering education lead. I have a master's PhD from Cardiff University in Wales and over 20 years experience practicing and research, especially in the area for medical device innovation, design, and also thinking about what is on the ground and making as much as possible to educate the engineers, also in biomechanics, motion capture, and some of the imaging studies. Next slide, please. I would like to show you this. There's QR codes where you can sign in for the Toolkit newsletter in both English and French. And also you can follow in all the social medias. The series are very many other ones. So 10 core components of small and sick newborn care from WHO and UNICEF. So please take your time to follow the QR code and go to the toolkit. And this is very important because we're not reinventing the wheel. So most of the information required is normally there. Next slide, please. I would like to also highlight upcoming webinars. So on the 17th of February, we have Data in Action, Driving Foster Newborn Quality Care. And on the 10th of March, we'd like to invite you to to have a webinar on better breathing for tiny babies, what next for antenatal, corticosteroids, and caffeine. Next slide, please. I would like to invite Alison to take us through this slide on French, and she'll be one who will be translating the French information. Thank you. Welcome.
Thanks, June. Donc, bonjour et bienvenue à tous nos participants parlant français. Si vous voulez écouter le webinaire en français, s'il vous plaît, cliquez sur le bouton de traduction affiché sur le barre de menu de Zoom. Je veux aussi partager quelques webinaires à venir. Le 17 février, on a un webinaire sur les données en action, accélérer l'amélioration de la qualité des soins prodigués aux nouveau-nés. Et sur le 10 mars, une meilleure respiration pour les petits bébés. Quelle est la prochaine étape pour les corticostéroïdes prénataux et la caféine? Donc, bienvenue et si vous voulez introduire dans le chat en indiquant votre nom et votre pays d'origine. Merci. And I'll pass back to June to take us through the schedule. Thanks.
Thank you very much, Lauren. Next slide, please. Yes. So today, we'll have a very amazing panel where our first talk will be from Newborn and Maternal Technology Landscape, and then we'll hear about EWENE Commodities and Device Group, all the latest updates. We'll think about the Maternal Neonatal Device National Procurement System from George Banda in Malawi. And then our fourth talk will be Device Consumables, the Missing Part, ABC, Device Planning and Costing from Alice Tarus. And then for our fifth one is Inspire RFA announcement by tired, and I'd like for you to stay that long. It's a very exciting announcement. And then we'll have our Q&A. So if you have any questions, make sure you put them in the Q&A section, and we'll be able to answer them at that point. So thank you very much. And next slide, please. I would like to invite our first speaker, Becca Kirby, Research Assistant Professor at Kellogg Northwestern University, Chicago, USA, Market Access Director at Nest 360. She has experience in designing scalable solutions for newborn health market in Africa, has led global market assessment, collaborated with UNICEF, and developed the Newborn Technology Landscape report and database. So please, hands together for Becca Kirby for our first talk. Thank you.
Thank you, Dr. June, and hello, everyone, and thank you again to the Newborn Toolkit team for having me here today. Today, I'm excited to introduce the new and improved Newborn and Maternal Technology Landscape, or NMTL for short. At its core, this is an open access interactive tool that maps more than 150 newborn and maternal technologies that are specifically designed for low resource settings. This work comes out of a broader effort to make sure that technologies that are intended to save lives actually work in the environments where they're most needed, and that decision makers can really see that full picture of what exists. Please note that while we're starting today with the gap of medical devices, the next presentation will feature a broader picture, including medicines and other commodities as well. Next slide. As many of you on this call are aware, despite decades of progress, preventable maternal and newborn deaths still remain unacceptably high, especially in low and middle income countries. One major contributor to this is a technology mismatch. Many medical devices are designed for high resource settings, and then when they're deployed elsewhere, where power might be unstable or maintenance capacity limited or just clinical workflows differing, that might impact. We end up seeing equipment graveyards where donated or procured equipment lies dormant and unused and broken down. However, we do know that there are many exciting innovations that exist, but the technology ecosystem can be highly fragmented, and decision makers can lack a single trusted place to compare options, to understand trade-offs, and to see what's missing. That gap is why we developed the NMTL. Next slide, please. Nest 360 developed the NMTL to provide visibility into what medical devices are commercially available or in the development pipeline, and it is now an open access web-based tool that catalogs more than 150 maternal and newborn technologies. It was originally designed in 2019 as a static PDF, and after the publication of 11 editions, we launched into this interactive platform in 2025 that allows users to explore, compare, and understand devices across the care continuum. Our goal was really to increase transparency and the ability to compare and make informed decisions for innovators, implementers, investors, and policymakers as well. Next slide. So as mentioned, it didn't start off as this interactive platform. Between 2019 and 2024, the landscape was really a series of PDF editions, so from the first through the 11th edition, and they were widely used, but there were many limitations, some of which included that the content was static, so there were challenges staying current. So if devices came on or off the market, they had to wait until we had that cycle twice a year where we would do a call for new information. And it also limited the ability to compare technologies against each other in a PDF format. So in 2025, we evolved the NMTL into this fully interactive online database, making it searchable, filterable, and much easier to update on an ongoing basis over time. And this shift reflects how we actually want people to engage with the information. We want it to be dynamic as the technology space continues to evolve. And again, just to highlight our growth, we started with 40 technologies in the first edition, and now we have over 150 technologies from 79 different organizations. Next slide, please. So you can see that the landscape really spans a wide range of technologies, from diagnostic tools like glucometers to respiratory support like devices, CPAPs, treatment tools, radiant warmers, and syringe pumps. And the goal is breadth, not endorsement of specific technologies. The status of technologies may also shift as technologies do come on and off the market. And we also feature innovations that are not yet commercially available, but in the development pipeline, whether with a fully functional prototype or just research use only. Next slide, please. Different stakeholders will extract value from the NMTL in various different ways. So implementers can use it to better inform procurement decisions. Innovators might use it to identify white space and do competitive assessments, and funders might use it to better align resources with real gaps rather than duplicating efforts. So for example, whether you are a healthcare provider who's looking to identify the best tool for your specific clinical context and make a recommendation, or you're an innovator who's looking for gaps in the market where further R&D might be needed, the NMTL can support that global alignment towards improved newborn and maternal outcomes, which we're all working towards. Next slide, please. What makes the NMTL powerful is not just the data, but how it's structured. So users can filter by device type, they can compare technology side by side, and they can see products at different stages of the development all in one place. So rather than just me talk about how great it is, I'm going to do a screen share so that we can actually walk through some examples of how you might use the NMTL and interact with it. So we can progress to the next slide and imagine you're a policymaker or an implementer asking which device, neonatal respiratory device, you might want to use in your hospital. So first you'll look at that announcement, and that's just to say that all technology is it's submitted by manufacturer. So say we want to look at a CPAP. We can see that there's 13 CPAPs in the landscape. Through the columns, you can see the organizations that manufacture them, the timing of the most recent update, which countries they're distributed in. You can see whether the pathway of care, the intended use, features, the price. There's also various CPAP specifications to compare individual needs. So whether you need, here's the regulatory status. Say you're trying to compare CPAP specific, whether you need heated humidification. You can see all of the comparisons here as well, whether you need an onboard air compressor. This grid view really enables the comparison and enables you to view side by side all of the different options. You can also view in a grid format as well, or a list format as well. So say you would like to view, you can filter and sort. For example, you can look for, here's the other view as well. You can search for organization name if you want to find something specific. And there's also this gallery format, another way of viewing it. This is more like a traditional catalog where you can see the different technologies. Again, if you would like to search for a specific name of a technology, you can type it in and find more information that way. Again, we've talked and we'll talk a bit more, but this is open access. We really encourage you to submit if there's not a technology here. Oh, and one other thing is that you can filter for different maternal technologies as well. We're still expanding that as well. You can filter by commercial availability and the status of the device. If you do not see a technology here that you're familiar with, we encourage you to invite the manufacturer to submit the technology. All you do is navigate to that Submit Your Technology. You can click here for the product category, and the specific fields will update based on the UNICEF TPPs for the fields that exist. And finally, we really would love to hear from you and how you think this could be improved. If you navigate to that About page and you fill out your email, we'd love to schedule time with you to conduct a user feedback interview. We know that this has many opportunities for expansion and improvement, and we would love to get your feedback. So next slide. Again, we developed the NMTL with the key design principle being open access. So we believe that transparency is critical, and we want to ensure that every innovator has the opportunity to participate. We believe that this will foster that more equitable innovation and collaboration, which will ultimately better align the global ecosystem and accelerate learning and innovation across the ecosystem. Next slide. So in summary, the NMTL brings clarity to a complex technology ecosystem. Again, we talked about how it's highly fragmented, and our goal is really to make it as seamless as possible, have all of the information in one place, the interactive resource to better support decision-making in maternal and newborn health. We welcome new submissions, and we encourage you to contribute new technologies. Again, all of the information is submitted directly from the product developers and manufacturers. So we encourage you to invite them to participate if you don't see their technologies featured here. We also encourage you to explore the platform. And finally, if you have feedback and how it could be improved, please don't hesitate to reach out. Next slide. Here is a link to the QR code. Thank you for your time today. I appreciate it.
Amazing, amazing. Thank you so much, Becca, for that. I loved the idea of transparency and open access, and the way the information is reiterative. And also, like, I didn't know we got to 151 devices. Good job to the whole team. And so we can have a look at the website with the QR code. And I like that you can view it, you can edit it, you can add different aspects of it. Thank you very much, that. So if you have any question, please put in the Q&A section. I would like to invite our second talk from Lisa Hedman, Senior Advisor, WHO Division of Access to Medicines and Health Products, lead of WHO EWENE Commodities Working Group, Each Woman, Each Newborn, Every Time, has led global supply procurement, market shaping, and public health emergencies initiative. So let's hear more about this and the updates that they have so far. Welcome, Lisa.
Thank you so much. I'd just like to introduce, thank you for that nice introduction. And I'd like to just introduce the Every Woman, Every Newborn, Everywhere network. Sometimes we call it EWENE. This is a network that's been going on for a long time under different names, and it includes at global level UN partners and a number of others, as well as large groups of countries who participate in these strategies. Next slide. Within the EWENE partnership, recently we formed a health products working group, and the health products intends to cover both medicines and devices as being equally important in the delivery of services. And this health products working group has a pretty clear purpose. One of the things that we're trying to do is work on alignment. Fragmentation in this space, both at all levels, is actually an issue that affects access to medicines. When we all do things differently and come at problems differently, it tends to reduce the impact of our collective efforts. We do want to have a coordinated approach because, again, timing and how we do things is an important issue. And then also when we look at progress, we do need to be walking down the road of progress together. And so it's not a donor-driven initiative or a country-driven initiative by one country or two countries. It's really intended to be a community of practice that works toward developing solutions to problems with access and uptake of commodities that could save mothers and newborns. Next slide. Sorry, I'm trying to turn my video on, but it's not letting me. I'll keep trying. So I want to start with the good news before I go into telling you a little bit about some of the problems that we found. We have a couple of big events coming up. We were just recently in the Global Health Supply Chain Summit with a pre-meeting to actually work with the partners, with the EWENE partners, but also with a group of countries to help us with some of our products going forward. And I think our next big appearance will be at the International Maternal Newborn Health conference in Nairobi in Kenya that's coming up in March, to be actually launching some of the tools. And watch this space because there's certainly more than what you're seeing on the screen, and we'll keep you posted on different events, both through the newsletter and the Toolkit newsletter, as well as through the EWENE website. Next slide. One thing I wanted to talk a little bit about is really the importance of working together, and that's why we held this pre-conference meeting at the Global Health Supply Chain Summit. We all know that supply chain is a big component of access to medicines, and so tapping into that community. but also tapping into the fact that this is where we actually see a lot of representation from countries, and being able to have a full day of sitting down, going through the challenges and looking at the solutions, and not to keep rehashing the solutions, because this is the space that's been out there for a long time. Access to medicines, access to maternal and newborn products has certainly been a problem for quite some time. So what we weren't trying to do is reinvent the problem and keep on talking about the problem, but really look at what would it take to work together, and what are the things that we can do both within a country to work together, but also within groups of countries and regions, and also including global partners. Next slide. So as we mentioned, I wanted to talk a little bit about the IMNH sorry, the conference coming up in Nairobi. I wanted to talk a little bit about something that we'll be launching there, which is a pathway about increasing access to quality maternal and newborn products. And that was really the result of a lot of work, various consultancies, but also particularly the country engagement and support that we found at the Global Health Supply Chain Conference. We'll be introducing this pathway in Nairobi earlier this year, and we'd encourage everybody to work with us, uptake that, and work to join a common approach to tackle some of the access challenges. Next slide. So this again gives you a little bit of what the roadmap. It doesn't necessarily. We know that there's a lot of roadmaps out there. There's a lot of landscapes out there, and they each bring a particular value to the problem solving arena. But what we wanted to do with this one is really dig into the specificities of the different products that really could save a number of maternal and newborn deaths if they were used properly, if they were accessible, and if they were affordable. And so knowing that no two products actually face the same challenge, they will all face different challenges, but how do we actually get into the details of that, and how do we pull those levers, and how do we pull them together? Working across purposes is obviously the worst thing we could do, but really trying to leverage our collective impact by digging into the deeper issues to say, well, what are the problems? Because they are not the same and I think that hearing from Becca about the device landscape, we all know that what happens to a device and the systems that it goes through are different from what happens with medicine. So being able to really dig into that and get into the details of that and engage at not just that broad level of commitment, but really the implementation level to say, what is it that we need to do together? And so we're really looking forward to sharing this with you in the coming months. Next slide. So I want to go back and talk a little bit about the problem, because I think it does help to understand how we came up with these things and how we categorize this. In terms of the UNITAID partnership, I'm with WHO, so I am going to give a little bit of WHO perspective behind this. When we look at access, there's a continuum, and it links all the way back up to the SDGs. WHO has its own roadmaps that we use, but the roadmap is generic, and it's intended to be used in the way this pathway for MNH commodities is being used, which is that you develop something very specific around the commodities where you have a problem. So, but what's really important is that when you look at access to a product, there's two sides of it. One is that there's problems with the product or challenges with the product. The other side is that there are challenges with the systems where that product is delivered. And people do tend to come back and go, oh, well, procurement is bad and regulation is bad and this is bad and it's bad. But one single product can't really change those systems-based problems. So we like to separate them so that we can really look at this is the how part. How do we tackle this? Something that's specific to the product is one thing, but something that's really coming from a health system standpoint means we need to join hands with those who are regulatory affairs. We need to work with them. We shouldn't be trying to change regulatory affairs with a single product or group of products. We need to be contributing to that larger continuum of regulatory capacity development. And I'm just using that as one example, and I won't go through the entire continuum here because you'll have a copy of these slides to take a look at it. But we've just divided it up in those two things, really to help focus the efforts and the strategies that are put in the pathway. Next slide. Thanks. I want to talk a little bit about the urgency of what we're doing. And I think I don't need to explain to people that we're in a globally constrained market around the world. And obviously that has been exacerbated by the lack of foreign assistance funding for a large number of countries. So one of the things that I just want to make the point about is that when you take that funding away for countries, that means that local procurement systems have to procure the products. And so we're standing here in the maternal and newborn space where those products typically were not really purchased very much. There are some matching funds and things like that where there was some support, but the level of support in terms of procurement of products with HIV, TB, malaria, and other um, what we call priority diseases, that has never really been in the maternal and newborn space. And so you say, well, but that means we're okay, right? Because it only affects those medicines. Unfortunately, what we'll see is we'll see the economic impact. We'll see national budgets really straining to do more with less, where they have to absorb the procurement of those products. I think the other thing, and I'm going to give a case study of this at the end, at time permitting, um, there's two problems that we have. Some products we're concerned that they all are at risk of being discontinued, and whether it's just all manufacturers, particularly when you have a single source, there are some products that are at risk for either manufacturers leaving markets, and particularly if there's few manufacturers, that could mean the product is discontinued. That is not necessarily, and I'll come to this in the case study. That's not necessarily the only problem. Another problem that we see is that people silently start increasing their appetite for risk. And when I say risk, I'm talking about the risk of quality assured versus non-quality assured products. Non-quality assured products tend to cost less. And so what we see is that there's this silent increase in the appetite for risk in accepting products that may not be quality assured. And both of those things would create disasters in our access strategy. So it's something that we're looking at and paying close attention to. Next slide, please. So I'm not going to read the whole thing. I'm going to give you a bunch of numbers and then come back to make the main point. We took a look at some of the tracer products from the EWENE partnership just to say, well, what is it that we're seeing and how do we use that information to track or to develop pathways and interventions. And we're going to be doing a larger survey. So when you see these numbers and you might ask, can I have them? I'm going to say, no, you can't. You have to wait for the actual survey that we undertake where we can pull out different groups of commodities. But these are some of the typical things that we look at when we measure access. There are more, but these are the top ones that we did in just a rapid review of a group of countries. So it's the regulatory status. Is it eligible in regulatory harmonization schemes? In other words, we don't have to register it 25 times. We can use one dossier to support a number of different countries. What's the procurement status? Did somebody buy it? Not just do we think it's available on the essential medicines list, which is a big issue, but is there evidence that someone actually purchased it? And when we say purchased it, we are talking about the public sector, not the private. Is it in the treatment guidelines? Oftentimes, if someone doesn't know or if it hasn't been integrated into in-house training in hospitals and clinics, it may not be used even if it's being purchased and if it's in the EML. And so obviously, of course, there's a big difference between the WHO EML, which we use basically as a tracer or a tracer indicator, but also national.
Hi everyone. Since Lisa has dropped, we're trying to get her back, but I think we've got a very good wealth of information about health products, both from pharmaceutical and devices. And if you go to the website that has been put in the chat, then you'll be able to get more information on this. Apologies about that, and if we have any Q&A and questions for Lisa, please put them in the chat.
Yes, thank you for that. Sorry, we just had a small interruption in the internet connection here. Do I still have 1 minute to wrap this up?
Yes, you can have 1 minute.
Okay, fantastic. Okay, so let's just jump to the next slide. This is the next slide is a list of countries. We don't need to go over that because you'll have a copy of the slides and you can see the countries that we focused on. Next slide. what we did is we went and scored, we gave a score to the different products based on where we saw access. And so the fact that there's a number means that there was a positive outcome. The lower the number means that you had fewer of these metrics that were met. And so, again, these are tracer commodities in a small group of countries, but it did help us to understand. You can see that the total score, the total access score is something that we invented for this rapid review. But there's also subscores where you can see that where different commodities differ in terms of where their problems are. Next slide. And in this one again, I've highlighted some of the things in red. When you look at the commodities and see what does this thing tell you, one of the things that we really notice is there's 2 products on that tracer list that are innovator products: the drape and heat stable carbetocin. Carbetocin is not an innovator product, but some of its uses are new in terms of the indication for prevention of PPH, and we hope another indication is coming forward in terms of treatment. So those products, it didn't surprise us that they had more limited outcomes in terms of the types of effort that they need. One of the other things that I'm going to come back to is this issue of data. And one of the things it's a big challenge is that here and all over this the maternal and newborn space, we're often dealing with what we call the best worst data. In other words, there's a paucity of data, and part of that, in terms of the commodities and the products, part of that is because when we're dealing with donor-funded procurement, there's a lot of reporting requirements, so you tend to get a lot of data. But when there aren't reporting requirements, you don't really have access to large volumes of data, and the data systems that are being used may or may not really be set up to get the types of things that we're after. So one of the asks that we're going to be focused on, again, as I mentioned earlier, we will be doing a survey on a larger group of products that will push up. We actually track shortages and other problems of medicines, and we will continue to use that survey again and again. So the surveys will be different, but we're going to continue to push them out. And I'll do one last thing on this case study of the contraceptive implants. And I think everybody knows that the donor funding has a big impact on products like this. The impact is not the same, but I wanted to give that one example because that product, about 90% of the market is donor funding. And without the donor funding, will local governments, will national systems actually be able to absorb it? And we're going to be facing that challenge. In some cases, it's 1 or 2 manufacturers, but they could be regionally very significant if it's not a product like the contraceptive implants. If there's another product where there's 1 or 2 regional manufacturers that drop out, it suddenly means that there's a lot of competition to go outside of that region to get access. So I really look forward to working with all of you. We'll be putting a survey out. We'll be using your newsletter to reach the membership in your group, and I'll be looking for the questions in the Q&A from all of you. So thank you so much.
Amazing, Lisa. Thank you. Wealth of information. I like the way you mentioned not only the products, but also the systems. I would like to invite George Banda. He's a technical advisor to the Ministry of Health in Malawi, a biomedical engineer who is very important. I normally say the engineers are, our babies are the machines, and if we take care of the machines, then we take care of the babies and the mothers. So he has over 8 years experience, so the wealth of information he's going to provide will be very, very amazing. So welcome, George.
Thank you, June. Okay, yeah, so today I just want to share the process that went through the selection of maternal devices for Malawi. Next slide, please. Yeah, and I want to begin by sharing this guiding principle. This is very key to making sure that you select the right device for the setting, which will also ensure that the devices are well optimized to save as many as patients and for a long time in use. Yeah. Next slide, please. Right. So the process of selecting the devices we went through a series of meetings, carefully considering so many factors that go into the device, especially when it's put into practice. So one of it was the purpose. So we want to select the right device. There are so many considerations of maternal devices, but our goal was to select the device which will have the highest impact in maternal care. Okay, and secondly, also about practicality, especially specifically looking at the complexity of the device. There's always a tendency to select a device with the highest end features, but usually in especially low resource settings, those devices, they also come with some negative effects. It comes with high maintenance costs, user errors, as well as high purchase cost. So instead of buying the device with so many features, which will also never be used in practice, you buy the device with that feature and maybe use the rest of the money to invest in consumables or other crucial devices. And we also considered usability. Yeah, most of the devices, sometimes they do fail because of user errors. And there's a tendency for some maybe to blame the healthcare workers, but the device itself has a very huge impact on user errors. So selecting a device with too many features or with a high end, it can lead to so many user errors, making the device not available most of the time. I'll give an example of maybe an anesthesia machine. You find that some are buying an anesthesia machine with a touch screen with very advanced features, while the nurses on the ground are used to manual flow meters. Okay, yeah, and between those two devices, there is no any noticeable improvement maybe in the service. So it's better to go with those features that our users on the ground are already familiar with. And there are also issues of maintainability. Okay. In our settings, we still have issues with maintenance. So we needed to consider devices which are already supported in the facilities, which the supply chain, in terms of maintenance, we already have existing supply chain that will be able to take up those devices in the country. And there are also issues of sustainability. We understood that the developmental partners will not be there. They will leave at some point. So will the government be able to sustain and continue offering these services or continue managing these devices? And there are issues of environment, the infrastructure and the power. Power fluctuations have a very huge impact into the success of devices. Infrastructure, are there existing rooms, power that can support these devices? And further to that, we also considered instruments like the WHO and UNICEF will look at what are some of the devices or what is the direction in devices for maternal care. We also looked at the local instruments. So like here we have the health service delivery package, which lists all the services and interventions that are offered at maternal care, and also the national standard equipment list. So these two are linked. So all the services and interventions that are listed in the healthy service delivery package also have a corresponding device in the national equipment list. Okay. Next slide, please. So the whole process took about 6 months. And first of all, we needed to understand the landscape and the interventions that are offered in country. Yeah. So what services are offered in maternal care. And then there were several consultations with key stakeholders, the MOH specialists, the maintenance teams, the developmental partners, professional bodies like PACHA, AMAMI, and the like, and in order to select the right equipment for the country. And then we also did some survey, questionnaire, where an online questionnaire for both the governments and the users to understand their needs and their challenges with the device that are already in practice. And then we also did an analysis and comparison with specs. Sometimes relying on specifications alone can drive someone to buy any type of equipment. Most of the equipment which are not even durable will show those high-end specifications, but when put into practice, you find that they don't last long. So we did that survey to understand their experience, the governments on the ground. And from that analysis, that's when we started the process of prioritization to select the final list of the devices. Next slide, please. So this is the device list that the team arrived at. So you can see, like, for example, on an anesthesia machine, there are two types of brands. We have the Gloucester Vent and the Mindre. So several considerations came up to select these ones. So we found that for the Gloucester variant, we considered that it has backup power. It's simple to use, and it's good for settings where they have power challenges. And for maybe tertiary hospitals, we considered the MINTRE, which can offer additional features through which the services are offered at central hospitals. So we found that maybe installing a MINTRE at a secondary level or primary level hospital would not do any good because it's too complex and it has features that are never offered, and it doesn't have backup power that would be useful in those settings. So the same thinking went through the selection of the rest of the devices. Okay, we can see them at parameter monitor. There are two types that we are buying. We understood that there's a standard one and there's one for surgery, which is very key in the services that are offered at tertiary level care. Okay. Next slide, please. Next slide, please. Yeah, and one aspect that was always in our minds during the whole process was the issue of sustainability. Next slide, please. Yeah, so sustainability is very key. We need to make sure that the devices, they will stay very long and there are systems in place to support these devices. So in this process, the government and its agencies like central medical stores were the lead. This is to make sure that all the processes that we are going through are being institutionalized, and there's always a buy-in from the onset. Okay? And also to support the government in tracking and ordering of the equipment. They need to be able to predict and focus when the ACS or spare parts or consumables will last and when they need to order to get the inventory levels optimized. And also consumables, very key. You can't operate the devices without their associated consumables. So this was always in our mind. We're working with the local distributors to make sure that there's a supply chain is well optimized and streamlined, and that there's always quick access to consumables whenever needed. Yeah. And another key aspect from the whole selection process is the multidisciplinary team, working with from the healthcare workers, understanding their level of competency and practice, and working with the PowerMates to select the right device for both the users and the PowerMates so that they can be able to maintain. Okay? And we have the clinical team who are the end users, and the data team also to guide us in terms of data and how these devices are working. And lastly, capacity. Capacity is very key. Yeah, most devices, they fail because the team on ground, they don't know what to do with the device. Yeah? And some will not even use the device because of lack of knowledge. Yeah. Thank you so much.
Amazing, George. Thank you for that. I like that that last sentence you said, that sharing and learning together makes the dream work. So I will now introduce our fourth speaker, Alice. Alice is a health economist and implementation researcher focused on newborn health and health system strengthening in sub-Saharan Africa. So we've learned how to narrow down the device that is needed, and now we want to see how and who is going to pay for it. So Alice, welcome.
Thanks, Joy, and thank you for the introduction. Today, next slide, please. Yeah, today I'm pleased to talk about device consumables. As George has rightly put, we need to think of consumables right from the start. Next slide. We all acknowledge that adequate and functional devices, and of course with other health system inputs, they are key for quality small and sick newborn care. But then what does it take to keep them functional? We need the continuous supply of consumables and timely maintenance, which is not cheap. The cost might look small than the cost of buying devices and easily ignored or left out, but in the long term, it adds up. However, despite the importance, it's not often budgeted when the devices are being procured, and even in the annual hospital budgets. And partly it's because of lack of evidence on how much it costs, on which items to buy, and even the tools to be able to support planning and budgeting. Next slide, please. So this piece of work is building on a tool that we developed way back in 2023 to be able to plan and cost for devices specifically for newborn. Just to give a brief about the tool, it was co-designed by newborn experts, and it helped identify the devices needed, how many of which is needed, and approximate cost to be able to plug that into budgeting. And again, just acknowledging the big group that was involved. Thank you all for the inputs. And since the launch, the tool has been downloaded close to, I think, 1,000 times, and it has informed investment in a number of countries, and it can be accessed, of course, on the QR code on the left. And to further understand how the tool was developed and the evidence used, please feel free to scan the QR code on the right. Next slide, please. A bit more on how to use the tool. So noting that this tool can be used to inform plug-in budgeting in either investment cases or in national health sector plans, or can be used even for one facility. It's an Excel-based format and follows a stepwise approach. That is, it identifies the item, quantifies and allow costing, but then it also has option of default and able to auto-generate estimate, or very flexible and can be adapted based on the user case. And before using the tool, you need to set it up for your context. And this mainly involved you defining your use case. Are you planning for national level? Are you planning for a subnational or even a facility level? You need to specify the number of beds that you are planning for, and also the number of facilities, among other considerations that we do have there. Next slide, please. So to give a snapshot of the devices listed, so we have 16 devices as default, mainly based on the WHO norms, the UNICEF guides, and very many countries' national policies, for instance, Tanzania, Uganda, and quantities are based on a 10-bed high dependency unit. And noting the focus is on incremental estimate, as it allows consideration of what is already available, and noting available and functional. We might have the devices, but it's not functional. And again, noting that the entries are very editable for easy contextualization in terms of both the numbers as well as the cost. And we'd like to credit some of the inputs from a big group from UNICEF team, co-designed from the Tanzania government, as well as the GFF team and Nest 360. Next slide, please. So having estimated the number of devices, we have said you need to start thinking about consumables right from the start. So the next is to ensure that they are functional and having the right consumables. So this is a new content and it's still work in progress. So currently we have consumables for 9 out of the 16 devices, and the estimates of quantities is based on the consumption for 1 year that was supplied by Nest 360 across the 65 neonatal units in the 4 countries, that is Kenya, Malawi, Tanzania, and Nigeria. Next slide, please. Next slide. So we are still working on this, and we continue to welcome inputs, and specifically we are looking to estimate the quantities and the cost of consumables based on the clinical need, and we are doing this together with a group of biomedical engineers, NEST, and as well as PANSA. And we are sort of looking to start with specific devices, for instance, CPAP, to know how much is needed. And we continue to welcome input even as we refine the ratios with the new data that is coming in. Again, feel free to provide feedback, suggestions on how we can improve usability, the content as well, and even how to fine-tune some of the inputs by scanning the survey. Shouldn't take a lot of time, around 5 minutes. Thank you.
June, are you coming in here? Or shall I just jump
Oh,
ahead?
sorry. I was talking. I was talking. Apologies for that. I'll just okay. Yeah,
I can
so
just jump in to save time.
yes, amazing.
So,
Thank you,
hi,
Jeffrey.
hi everybody. My name is Jeff Smith. I'm a senior technical manager at UNITAID. I have some friends on this call, and it's really great to be invited to let you all know. Could I have the next slide? Know about an upcoming opportunity. So, several speakers on this webinar so far have talked about how we need to not only work on availability of the products, but we need to fundamentally address some of the system issues that are really enabling or holding back the availability of critical commodities, critical health products. And by health products, I'm sure we all mean the diagnostics, the medications, the devices, and the supplies, as has been mentioned by multiple speakers. You know, UNITAID firmly believes that there is progress to be made in improving availability and access to these critical products. And therefore, we are committing substantial resources to help countries to address this issue. So we're happy to announce about 2 weeks ago, we launched a call for proposals for a new program called Inspire. The Inspire program is improving national supply chains for product access and resource effectiveness. And we're dominantly looking at maternal newborn health products in this call for proposals, but we recognize that the issues that we're trying to address are systemic issues. They're issues of access such as proper quantification, appropriate financing, improving the procurement system, improving delivery of the products, all of the different system elements that Lisa alluded to in her presentation that are going to be part of the broad thinking of the upcoming EWENE pathway to improved product access. So this is a 4-year program, $25 million. We anticipate working in about 5 countries among the ones listed here. The impact that we're seeking is improved on-shelf availability of critical maternal newborn health quality assured products. And that will be due to stronger national supply chains. So we believe that it's very hard to measure effective coverage, but if we can, it's easier to measure on-shelf availability. So if we can measure improved on-shelf availability, then we will achieve greater access and greater coverage. We will do this through the 4 areas of work that are listed on the side. Ensuring supply chain systems deliver the products. So what are the different components of the supply chain? How can we strengthen those components for effective delivery? The second is addressing the governance and the financing barriers, including quantification, finance, procurement, purchasing, all those things that are necessary in order to get the products and get them delivered to the sites. The third thing is we know that we will have the capacity to work in about 5 countries. We hope over time we will have more resources and the ability to work in more countries. But for now, we will work in 5 countries, but we want to spread the information to multiple other countries. So we will also support cross-country learning and a multi-country learning platform that allows us to learn lessons and share lessons to kind of create that movement among countries. And the final area of work is a recognition that this can only be done with and through the partnership with civil society. Many of you saw the impact of civil society on increasing the availability of HIV products. We would not be where we are today in the HIV epidemic if we did not have the support of civil society demanding and advocating that the system enables the delivery of high quality HIV products. We want and we need the same for maternal newborn health products. We want to activate civil society to be advocates in the system and for the system to ensure access to critical products. So I'll stop here. There's more information about this call for proposals on the UNITAID website at unitaid.org. We're actually having a webinar on this proposal or this call for proposals tomorrow. You can go to the UNITAID website and sign up for that webinar. Proposals will be due 20th of March 2026, just before the IMNHC conference in Nairobi. And there's a new landscape report published by UNITAID just a couple days ago that really outlines some of the solutions, some of the processes that can be used to improve access. So I hope people will join the webinar tomorrow. I look forward to the engagement of this entire community as we work together to improve access to maternal and newborn health products. Thank you.
Amazing. Thank you so much, Jeff. Thank you for that. And I'm sure most of us will be able to join the webinar tomorrow. Just go to the website. I think that's where all the information is. Register. Information is gold. Next slide, please. A reminder that we have two webinars coming up on the 17th of February, Data for Action, and also on the 10th of March, Better Breathing for Tiny Babies. And today we've learned there's a lot of data, there's a lot of tools. So intentional use of these tools and data is very key. If you have pending questions, please put them on the Q&A section, and they'll be able to be answered. Remember, you're going to get a recording of this session, and then you can all the links that have been put on the chat are also available. Next slide, please. Use and contribute to the newborn toolkit, please. There's no need to reinvent the wheel. Remember all the numbers, remember the effectiveness, sign in to the Toolkit newsletter, both in English and French, and follow all the social medias. Thank you for joining today. Huge thanks to all the speakers. They are, I think I've learned more today than I've learned in the last, well, from the beginning of the year, let me say it like that, but amazing. Next slide, please. We'd like to thank our funders of the Alliance Nest 360. They're named there. I'm not going to read all of them. And then funders of the French toolkit as well. It's, translating the whole toolkit in French was a big boost to how the reach is of the toolkit, and we're getting more people to use the tools that are available in all the Francophone countries as well. And the Toolkit Expert Advisory Team, well done. This has been a feat, and it's continuing to grow and grow. I remember the first time what Alice has presented. I remember just when she started, and now it's just grown and grown. And you can imagine how many more tools are there for your use. And of course, the Toolkit team based in London School. Thank you so much. And if there's any pending urgent thing, I think we have 2 minutes left, but if there's anything, just put it in the question Q&A section and you'll be able to get an answer. Thank you very much for joining this webinar. Without you, we would not be able to disseminate and broadcast all these amazing tools that are available to be able to have efficiency, to be able to go faster together. Thank you so much, and good luck and good work, everyone. And also implementing all this work is on you, but also we are here to help. If you have any other questions, you can also still send an email, and we are here to help you. Remember, all the links are in the chats, and you can also ask if you have any other question via email or via the website. Thank you so much. And there's the QR codes as well. You can always go there and link into the newsletter, a wealth of information. I always read it every time, and also in social media. Amazing. Thank you very much, everyone, and the speakers.